All right, everybody. So welcome to this year's presentation on how to prepare for an interview. So we can go ahead and just jump right in, I think. So when it comes to what what we'll cover, more or less these are the points. So we'll talk about what's the number one question that when you do an interview, what's the number one question that really people are asking during an interview? So we'll talk about that. We'll talk about what a successful interview looks like. Okay. We'll talk about nonverbal communication. We'll talk about what does preparation look like? How do you prepare for an interview? We'll talk about asking questions. We'll talk about sort of the overall interview day. So there's the interview and then there are other components of the day. We'll talk about just sleeping well the night before, any off-the-wall questions, and then etiquettes around thank you cards and emails. So those are pretty much the main objectives for the talk. So I guess it might be worth starting off by asking, has anybody gotten any interview invitations?
Yeah, I do. I have one coming up in 2 weeks.
Wonderful, wonderful. Who is that?
Mavish.
Oh yeah, Dr. Adam. Oh, congratulations. Where is the interview at?
Mississippi.
Wonderful. Good, good. So which program in Mississippi?
University of Mississippi.
Good, good. What specialty?
Family medicine.
Excellent. So one thing that we would definitely encourage is that if you guys, so don't, I want to mention, don't underestimate the importance of connections. So I think I should have emailed to everybody where all the previous APs have matched. So those are places you probably want to apply to, or reach out to those assistant physicians that match there. You have their phone numbers, you have their emails. So that kind of thing goes a long way towards getting an interview. So I would just mention that as a suggestion. So, okay, guys. Well, okay, Dr. Adam. Well, good luck. Okay, let's hopefully this presentation will be beneficial. Anybody else have any interviews this season? What's that?
I did get an interview in Arkansas.
Arkansas. Is it the which program, Sybil?
The Arkansas University.
Is it
University of Arkansas Medical Science Virginia?
Yeah, that is the number one. That is the number one program where APs from the Medina Clinic have gone. The number one. We've had like 5 APs go there.
Oh wow.
Yeah, 3 in family medicine, 2 in internal medicine, if I remember right. So yeah, Arkansas, Arkansas is right underneath Missouri, so they're probably aware of the assistant physician thing. So good, wonderful. Anybody else?
Yes, I have one.
Oh, wonderful, Dr. Jorge. Where did you get one?
It's in Boston. Is Berkshire Hospital. Is an internal medicine program.
Where now?
Wow. Berkshire Hospital.
Okay, wonderful. Good, good. All right, awesome. Okay, so we've got. Oh yes, go ahead.
I got one, Dr. Murad. In O'Fallon Family Medicine.
Where at?
O'Fallon, Illinois Family Medicine.
Oh yeah. Okay, I've heard of them. Has any APs gone there? I can't remember.
Yes, Dr. Jafar.
Dr. Jafar, perfect.
Yeah.
So here we have University of Arkansas Medical Sciences, where Dr. Jafar last year went. So what does this mean? It means look to where the previous APs have gone. I really can't emphasize that enough. And when the previous APs match, I tell them, I say, make sure if any APs in the future reach out to you, you help them out. And of course, they're very happy to have matched. And they say, oh, absolutely. So you have residents right now in residency programs that are ready and willing to help you out. Okay, so just I would recommend taking advantage of that. Okay, all right. So good. Well, it looks like a number of us have interviews, so that's great. So let's go through our different objectives. Any questions right off the bat before we start? No? Okay. All right. So, you guys, when we're talking about the personal statements, the number one question for personal statements is why are you a good, why are you a good candidate for this specialty? I think. I mean, that's really what the personal statement is, not why you want to be a doctor. That ship has sailed a long time ago. No one cares about why you want to be a doctor anymore. Maybe they did 4 years before, but now they don't care. Now people, they care about, when it comes to the personal statement, they care about why this specialty. That's the main question. Now, when you do the interview, okay, when you do the interview, who wants to guess what is the number one question that they are trying to answer? Anybody want to guess?
If you would be a good fit for the program.
Excellent. Who was that?
So,
Sybil. Good job, Sybil. That's exactly right. Every question they may ask, a dozen, 2 dozen different questions, right? It's all the same question, literally. Every question is really one question, or it's a different variation of this one question. Are you a good fit for this program? Okay, for this program, are you a good fit? That is the number one question that they're trying to answer. So for the interview process, that's what you are trying to make the case to them that you are a good fit for their program. When you're doing the personal statement, it was, why am I a good candidate for this specialty? When you're interviewing, it is, why am I a good fit for your program? Why should you take you're trying to make the case, you should take me because I am a good fit for this program. All right. So that is the number one question that they're trying to answer. Good job, Sybil. Did you hear that from somebody, or did you think of it on your own?
I guess I thought about it on my own. And,
Look
and
at
also
that. You're a natural, Sybil. You're a natural. Very good. Very good. All right, guys. So let's move on. So that's the mind frame. Okay, that's what you have in your mind. You are trying to make the case that you are a good fit for their program. That's the mindset. Okay. All right. So the next thing is what a successful interview looks like. Okay. So if you were to look at an interview, and let's pretend you're looking at an interview and the sound is off, okay? The sound is off. So then the question is, what do you see? So if you're watching an interview, if you're a fly on the wall, but you're not hearing anything, you're just watching, who should be doing most of the talking? Who should be talking more? I mean, it's on the slide, but
Interviewer.
what's that?
The interviewer.
Yeah, the interviewer. The interviewer should be doing by far most of the talking. If you're the interviewee and, excuse me, you are doing most of the talking, you're in trouble, actually. It's interesting. I remember when I did this presentation last year, I got a lot of pushback on this, and I didn't mean to be insulting, but what I was trying to say is, look, guys, no offense, but your careers have not been that long, okay? You don't have that much to talk about. Now, I didn't mean to be offensive, but your careers have not been that long. There isn't that much. I mean, there's a lot to say, but not enough to dominate an interview, okay? The person interviewing you, if you have to pick one, it's better for that person to dominate the interview. So if you're looking at an interview and the interviewee is just doing all the talking, that's a bad sign. A good interview has the interviewer doing most of the talking, all right? So what does that mean? It means that as the interviewee, when someone is asking you questions, your answers are very concise and to the point, all right? That's very important. Look, I'll be the first to admit I have a tendency to ramble, okay? If I don't have something well thought out, I'm thinking about it out loud, I ramble. It's very easy for me to ramble personally. I know that. So for me, I need to be very careful. I need to make sure that I don't ramble. All right. So my answers need to be concise and to the point and succinct. If I'm rambling, then I'm dominating the interview, and that is bad. Okay. The interviewer, the person asking the questions, it is better to have that person do most of the talking, all right? If you do most of the talking, that will create a bad impression in some indirect ways for the interviewer. The other thing that you notice, if you look at an interview that's going well, a successful interview, the interviewer is doing most of the talking, your answers are quick, succinct, and to the point. So let's see. So the other thing is that, okay, if the interviewer is doing most of the talking, the interviewee is listening, right? But you're listening and you have to have excellent nonverbal communication. So that's very important, all right? So your question is, well, what is that excellent nonverbal communication? Like, what does that look like? These are the things that I recommend. Number 4, dress professionally, that goes without saying. We all know that, okay? But here are the 3 things. Here are the 3 other things that I really recommend. Number 1 is you need to sit up straight, okay? You need to sit up straight, kind of in the middle. Don't tilt your head. Sit up straight, all right? So that's important. Like, I know myself, I have a tendency to slouch personally. I know that. So I need to make a conscious effort to sit up straight. Now, when you're sitting up straight, you need to do something that may feel a little unnatural, okay? But I suggest you do it. The next thing is maintain eye contact at all times. Look at the person in the eye, all right? The whole time, all right? I mean, don't get me wrong. I mean, you can blink, obviously, but just maintain eye contact. And while you're maintaining eye contact, smile, okay? Because this does a few things. I would say that it conveys confidence. And confidence is important in a resident, actually. So it conveys confidence. It conveys a certain level of professionalism. It conveys, and I think part of that is that it conveys positivity. And these are all things that people are looking for in residents. And so this nonverbal communication is very key. Like, you give the person the sense that they can have confidence in you to be a part of their team, be a part of their residency, all right? So you sit up straight, you maintain eye contact, all right? It may feel unnatural, but that's okay. Maintain solid eye contact. By the way, just so you know, in family medicine, when you're in a visit, you have a patient, and let's say it is a patient is presenting for depression, right? What's one of the things that they document in their note? They document if the patients maintained eye contact, actually. So this is almost sort of subconsciously what they will do is they will assess your behavioral, aptitude, and that'll be kind of one of the things that they catch is, do you maintain eye contact? So if someone maintains no eye contact, that's kind of like a red flag in a way. So it's key to maintain eye contact, and you smile. When you smile, that shows that you are relaxed, it shows that you're confident, and it shows that you're a positive person, because medicine is hard, and residency is hard, and life is hard. So you need to be able to show that you can be positive in a stressful situation. So sit up straight, maintain eye contact, and smile. And it goes without saying to dress professionally. Actually, I remember one interview, actually, I was about to go in with the program director, And just before I walked in, someone, I don't know, they were being extra nice or something, and they gave me like some chocolate, like Hershey Kisses, you know? And oh, and by the way, this is in Pennsylvania. I remember this interview. It was in Pennsylvania, and you have the Hershey, you know, Hershey chocolate. It's around there, right? So they were big into that, I suppose. And so right before I walked in, they gave me some Hershey Kisses. So I walked, and there was no time to do anything with these Hershey Kisses. Somebody gave it to me in my hand, and into the interview I go. You know, I had no time to put it anywhere. And so I go in, and then it's like, okay, well, the interview is starting. I'm sitting down. So I said, oh my God, okay, well, sit up straight, eye contact, smile, and go through the interview. As I'm going through the interview, the chocolate is melting. Like the chocolate is melting in my hand, you know, because, you know, your hands are sweaty, it's hot, and it's an interview. Like literally, it's melting in my hand. But I kept that eye contact, okay? I kept it. I smiled the whole time. And yeah, I got through it. And by the time I got out of that interview, I had to wash my hands because I had all this chocolate in my hands. But it worked. It worked, actually. It was a successful interview. So anyway, that just goes to show that these nonverbal things are the things to focus on when you're doing your interview as far as nonverbal communication. It's very, very important. So any questions on that? Yeah.
I have a question.
Uh-huh.
So in terms of doing a virtual interview,
Yeah.
maintaining eye contact can be a little tricky.
Yeah.
Got any
So
tips on that?
yeah. So I'm actually not a good source about that. So I'm literally talking about how to interview from 15 years ago. So the APs, actually, this is another thing to talk to the APs from last year. This is another thing, another reason to talk to them. They also, actually, they brought up the same thing about about this. So Dr. Cecil, do you remember what some of the comments were about that?
I believe that one of the things that was talked about, and I think also came up from the AFP conference from last year when they gave a little few tips on that, was keeping your eye on the, like looking at your screen and looking at whoever your interviewee is, rather than looking to the sides and looking like kind of scrolling down on your screen.
Oh yeah.
Maintaining that becomes your eye contact, because you can't look at the camera the whole time. You'll miss who you're speaking with, but then looking directly at them as you have them centered on your screen gives you that that sense of maintaining that eye contact. They actually like talk to like not do glasses, especially ones that reflect a bit, because it gets distracted and all that too. So it's something to keep in mind as well.
Excellent point.
So if you're able to do contact or not have your glasses on, it becomes better. Probably sleep as well, so you don't have circles around your eye like I do right now.
So is it like looking at the lens in on the camera, or looking at your computer screen?
Looking at your computer screen. So if you have your interviewee, like whoever is interviewing you, like filling up your computer screen, you're able to maintain that eye contact because you're looking up at them and your camera's right there. So it gives that illusion of making that eye contact. And that seems to help quite a bit. And I noticed that a bit too when I, as a fellow, when I taught the medical students, like when they're doing interviews, you could tell those who weren't actually looking at the screen and were looking away. That I kind of learned a bit from that and kind of tailored the way I look at my screen in that sense too. And those are a few tips from that.
Good, excellent question.
And one of the recommendations, I attended another meeting, they mentioned that if you can put like books or something underneath your computer to raise the level of the computer, that would help instead of your head being cut off or your hands not showing or your body's not, like to have a proper posture and to show like a full view instead of your head being cut off. So you can put some books underneath to raise the computer a little bit.
Excellent point. Because it's true, when the screen, if it's coming from down below, it's not as flattering a view, I think sometimes. Like, you know how you have your phone and if your phone is if you're holding it down like this, and then it's displaying your face from upward, it's not as flattering a view. You know, it's usually if you lift it up a little bit, it seems like it's better. So, okay, wonderful. So we got some updates on eye contact in the era of COVID. Good job. Okay, you guys, good. Any other, so, you know, I'm in no rush myself. Any questions about nonverbal communication? Okay, sounds good. So we can move on now to prepping. So I guess for me, when someone asks, you know, can you prepare for an interview? I'm not inclined to say, you know, some people say, no, you really can't prepare for an interview. You know, you go and you perform. I don't myself go with that school of thought. I do feel you can prepare for an interview. And so what I wanted to do was to share a method for how to prepare for an interview. So what I do is pretty much the following. Okay, so let's say this is what I remember doing before residency interviews. I would take a sheet of paper, all right, and on that sheet of paper, I would write out 10 questions, all right? So 10 questions. And these were the 10 questions that I felt were most likely going to be asked of me, okay? And honestly, I don't think there's a lot of variation on these questions. I think, and it may not be these 10 actually, but just, you know, you can research and you can even think on what are the 10 common questions that I would like to be ready for, all right? And you can think of these off the top of your head. I mean, honestly, tell me about yourself. Why are you applying to this program? A very common one is, tell me about a difficult clinical situation that you've had. Another common question is, tell me about a difficult time when a patient was upset. Another one that I've seen is, tell me about a time when you didn't perform well. How did you handle it? Of course, all you need to prepare for what are your strengths and what are your weaknesses. Why did you choose family medicine? You know, what about this specialty? What are your future plans? How do you deal with stress? What do you do for fun? So, so these are very common questions that an interviewer can ask. Can anybody think of other questions? Any other questions that folks have seen?
I had a question that was asked of me last year that I struggle a little bit to answer. It was, how do you resolve conflict? Like
Very good.
you had conflict with your attending or fellow colleague. How do you resolve conflict?
Right. Good, good, excellent, excellent. So, right, that's another very common one. How do you handle conflict? Absolutely. Any other questions that anybody feel is common?
I guess, where do you see yourself in 5 years? I guess that addresses your future plan, I guess.
Sure, absolutely. Yeah, absolutely. Good. So yeah, so these are all questions that can be asked. Now, what I want to share is this. It almost doesn't matter what your answer is, okay? I say almost, I mean, certainly it does matter what your answer is, but it's actually not the most important thing. The most important thing, so it could be the most mundane, generic, cookie cutter answer, okay? All right. It does not have to be, this is not an essay contest, everyone. Okay. This is not your personal statement was an essay contest. Okay. That was your essay contest. This is not an essay contest. You are not trying to be flowery and think of the most outstanding answer. That is not the goal here. Your goal is to deliver a solid answer that is succinct. Beyond that, your actual answer is secondary. Does that make sense? Okay. One more time. Your goal is not to have the most awesome answer ever. That is not your goal. Your goal is to have a succinct, solid answer. That is your goal. Beyond that, it almost doesn't matter what your answer is, because what you're trying to do is you're trying to create, remember what a good interview looks like. You are there to give solid, succinct answers. That's what your job is. It is not to give the most awesome answer, the most unique answer ever. That is not the point. Okay. So keep that in mind. All right. So if we keep that in mind, then that guides us, this guides us how to prepare. So I wanted to share how I typically prepare for interviews. So I start off by listing, like, okay, what are the around 10 questions that are the most common, that are the most likely to be asked of me. All right. And then what I do is for every question, I come up with like 3 bullet points, maybe 2 bullet points, maybe 4 bullet points, but around 3 bullet points. And I think about what those bullet points are going to be. And those bullet points should be geared towards why, it should be geared towards highlighting yourself, okay? It should be geared towards things in your background that you want to mention while answering the question, all right? And we'll see if we can maybe practice a little bit, all right? We'll try to do that. But you're going to think of the 3 bullet points. Again, they don't have to be the most outstanding answers. They just need to be succinct. So you just need some solid bullet points. And then when I think of those 3 bullet points, then I cap it off. So then you're like, what does cap it off mean? What do you mean cap it off? So if someone asks me a question, like, so during the interview, remember, what is the number 1 question that they're trying to answer? Guys, remember, what's the number 1 question?
Are you a good fit?
Are you a good fit? So what happens is when they ask the question, I deliver my bullet points, succinct, brief, and then I cap it off. And by cap it off, what that means is I then say, that is why I would be a great fit for your program. Okay? That's what I say to cap off my answer. So I say my few bullet points, and then I say, for these reasons, I believe I would be a great fit for your program while I'm standing up straight, eye contact, and smiling. All right? And the thing is, if I say that a few times, right? If I say that a few times during the interview, remember, they're trying in their minds, they're trying to determine, is this person a good fit for my program? So during the interview, if I cap it off a few times, this is why I would be a great fit for your program, and I say that a few times, then the interviewer comes away thinking, you know what? I think this guy might be a great fit for our program. You see what I mean? Because it's sort of like what do they call it? It's like a public relations or advertising kind of thing. You're like messaging, I don't know. It's like sort of subconsciously you're saying it a few times. So then they think, yeah, I think they would be a good fit. So anyway, that's what I mean by cap it off. So on my sheet, on my 1 page, things usually fit all on 1 page, to be honest. So I have my question, and then I have my bullet points, bullet point 1, bullet point 2, bullet point 3, cap it off. All right. And for every bullet point, I just write down a few words. I don't write my answer word for word. Okay. I just write a few words to make me remember what my point is. So I have my question, I have my 3 bullet points, and each bullet point is just a few words to help me remember what the point is. And then I make a note to myself to cap it off. So I write all that down, and really it should fit on 1 page. And then I study this thing. I study it. It takes me about 30, 45 minutes to study it. And then that's it. I'm prepared. Okay. And then the next day I might look at this again while I'm drinking coffee in the lobby of the hotel. and then I just make my way to the interview. And then I have prepared myself for the questions they are most likely going to ask. All right. So this is my method for preparing for an interview. You know, for some people, this might be a little too labor intensive. For some people, it fits their personality, but this is how I've typically done it. And what this does too is it helps me prepare so that I don't blank during an interview. So sometimes during an interview, things happen, things unexpectedly happen. Like for example, I have chocolate melting in my hand. You know, you have weird things that happen. This prevents you from blanking out, okay? So that's essentially the method. And so I guess at this point, I'll just ask, any questions about this before we do an example? Any questions at all? Okay. Well, if not, let's do an example. So what I might do, let's do a new slide here. Let me see if I can type. Okay. What question? Let's pretend I'm being in. Let's pretend I'm preparing. Okay. It's the night before. I just flew in to whatever city, and it's the night before. I'm in my hotel room, and I'm getting ready for the interview tomorrow, and I'm gonna think of 10 questions. What question do we want to type here?
Why are you changing a specialty if you are coming from a specialty that you did in your home country?
So why the specialty then, right?
Yeah.
Oh, okay, that's fine. What's
Yeah.
that?
I was trying to ask the question, why are you changing specialty? In
Sure.
case you did one specialty and you want to do one now. The question is because sometimes you know why you want to do this specialty, but how do you address the other specialty? What happens if you don't like it, or if you like it but you want to pursue something else? How do you address that?
So what's the question again to answer?
Why are you changing specialty?
Okay, from which specialty to which specialty?
General surgery to family medicine, for example.
Okay, sure. So that essentially is, why are you choosing the specialty? Okay, why are you choosing family medicine? It's essentially, so here's the thing, they're essentially the same question, you know, because it's a question on why the specialty. Why are you switching specialties? You know, what about this specialty is making you change? It's pretty similar. Like your answer is going to be the same as why are you choosing the specialty? So why are you choosing the specialty / changing specialties? Okay. Okay. All right. So let's think about this. Okay. Now the thing is, the beauty about preparing is that it's no pressure. You're by yourself thinking this through, right? You're not thinking about it in front of somebody, you know, so there's no pressure here. So you are at liberty to really, you know, to have a thoughtful answer. I don't know why the bullet point is not working. I don't know why. Let's just say number 1. Okay, so let's think of 3 bullet points, shall we? All right. So Dr. Jorge, so it sounds like this is a question that's been on your mind. What 3 bullet points shall we include?
I was asked that question, and I tried to answer the way like explaining why family medicine.
Yeah.
In my case, I say that family medicine is a specialty I've been in contact for a long time.
It's what now?
First in Cuba and then here. Then I said that I really like that you can treat people from every age, so you never get bored with family medicine.
Okay.
And lastly, I answered that family medicine gives you the opportunity to establish a lasting relationship with your patient and modify their lifestyle through health education and health promotion.
Okay. What was the first point that you had? Sorry.
The first one I've been exposed to family medicine for a long time, first in my country, in my home country, Cuba, and then here.
Close to family medicine?
Yes.
Okay. All right. Okay. So these are our 3 bullet points, right?
Yeah.
Okay. So if I were to review this, and then of course you're going to cap it off and you say,
I feel that through family medicine, I have the best opportunity to impact the overall health of the community.
sure, sure. Let me hang on one sec. I don't know what's up with these slides. This is, hang on a sec. Yeah, let's come back to that. I just need to, goodness gracious, black. Okay. That, oh, it's sorry, it just makes me do all caps. I don't know why. Great fit for your program. Okay, you don't want to scream this, but you just want to say it. Okay, so, all right, so when I look at this, okay, what I would say when it comes to your bullet points, my suggestion is you use these bullet points to highlight things about yourself. You guys are very modest, okay? You're very modest. You don't talk about yourselves very much. But this is the time to talk about yourself. Now, it's true. Normally in life, it's not appropriate to talk about ourselves very much. This is different. This, you need to talk about yourself. So for me, if I'm Dr. Jorge, right? If I'm Dr. Jorge, dude, I am talking about myself, okay? So for me, automatically, so let me extend this a little bit. Let me see. So these slides are weird. Okay, so automatically, I am talking about my experience as an AP, period. I mean, I would strongly recommend you need to hit this very hard, okay? Because they need to know about you. They don't need, because what we're doing with you treat every age, opportunity to lasting relationship, close to family medicine in Cuba. These are all things about family medicine. They're not about you. You need to talk about you, okay? They need to know why they don't need to know about family medicine. They already know. They're family physicians already. So you don't need to convince them that family medicine is great. They know family medicine is great. They're already in family medicine. They want to know why you need to be in family medicine. Do you see what I mean? There's a difference, okay? So for me, like, dude, I don't know if it's your first, second, or third point, but you better talk about being an AP. Like, I'm very serious. You better talk about this, because if you don't, then you're going to undervalue the experience. And as a faculty person, this is the most critical thing. Did I tell you guys about the guy 5 years ago who volunteered for us? And then he interviewed up in Wisconsin. And then like the local news, they did a story about the AP thing at the Medina Clinic. So he was actually in our second AP cohort. So he interviewed in Wisconsin. The program director literally went online, brought up the news story. He brought up the news story about the assistant physicians. It was very clear what they did as assistant physicians, and he matched to that program, okay? He matched to that program. So this experience is very key. All right, so for me, that's one of the points, period. Like, I don't know what your other points are, but that had better be one of them. So, okay, let's review the question again, right? Okay, why are you choosing family medicine? Okay, and changing specialties. So, so then remember, these 3 points, you need to highlight yourself. You need to think, what about myself do I want to share with these people? Well, if I'm Dr. Jorge, I'm thinking, I want them to know I was a general surgeon. Why not? That's good for them to know, and maybe as a general surgeon, you can convey how, while you can take care of patients surgically, there was so much more you could have done, okay? So that's an angle. So general surgeon, you could say we're limited in a way. All right, that's point number 2. Okay, guys, help Dr. Jorge out. What other points? What's something else about him that he needs to talk about? Remember, Dr. Jorge, we're talking about you here. We're not talking about how lovely family medicine is. We know family medicine is amazing, great, but we want to know about you. So guys, help him out. What else about Dr. Jorge can he use as a third point?
Does he have any clinical experience back in Cuba that was family medicine, or something he has done here besides assistant physician, or any research or any kind?
Yes. Yes, in Cuba, I practiced in the primary care in a rural community for a few months after graduation. And here I've been working in a family medicine program as a medical assistant for the last 2 years. So.
Yeah, and I think that's beautiful. Look at this, Dr. Jorge. This is what I'm talking about, okay? So MA in a family medicine program for 2 years. Beautiful. Now I would take these 3 points and let's put them in chronological order. So first was probably being a general surgeon, right? Then second is being an AP, and then oh, no, actually, no. Second is an MA in a family medicine program. Okay. And then third is an AP. There you go. So in these 3 points, you will share how you are experienced as a general surgeon. You will share how you are a medical assistant in a family medicine program and you're an assistant physician. These are like very rich points, and they talk about you, and they support why why you are choosing family medicine and changing specialties. Okay, so these are my 3 points that I'm going to put on the paper, and I'm going to remember them. I'm going to say, okay, like for me, I'm a studier. Again, not everyone is like that, but it's just 1 page. It's not a big deal. You know, I'm not memorizing it word for word. So I'm going to say, okay, I'm going to study this. When they ask me about specialty, maybe they're going to say, why this specialty? Maybe they're going to say, why are you switching specialties? But the point is they're asking about specialty. So when they ask about specialty, I'm going to think, okay, point number 1, I was a general surgeon and it was limited. You know, it was what I could do was limited. Point number 2 is that you know, I took the initiative to be an MA in a family medicine program for 2 years. Point number 3, I was an assistant physician and all the things with that. All right. So, okay. All right. So number 1, surgeon. Number 2, MA. Number 3, I was an AP. Okay. Those are my 3 points. So if that's the case, let's give it a try here. All right. Let's give it a try. So Dr. Jorge, why don't you ask me the question? You're the interviewer. Okay. You're the interviewer and you're asking me, okay, Dr. Murad, why are you changing specialties and choosing family medicine? And I will try to deliver those 3 points. So why don't you give it a shot?
Okay, Dr. Murad, why are you choosing family medicine as your specialty, and why are you changing specialty from general surgery?
Well, thank you so much, Dr. Jorge, for the question. I can tell you that in my home country of Cuba, practicing as a general surgeon, I was actually very limited in what I can do for patients because what my patients needed went beyond what I can do for them surgically. When I moved to the United States, I took the initiative to work as a medical assistant in a family medicine residency program where I learned so much about what it means to be a family physician, as well as being a student in family medicine. And then I took advantage of the opportunity to become an assistant physician, volunteering in a free clinic in another state, while under the supervision of a family physician to practice taking care of patients, prescribing, ordering, and following patients for their chronic diseases. And this really inspired me to pursue family medicine, which is the type of doctor I want to be. And knowing about your program This is why I believe I would be a great fit for your program. Done. Okay, done. All right. I mentioned my 3 points. The exact wording of my points is not that critical. The most important thing is I mentioned my 3 points and it was succinct and I'm done. It doesn't matter if it was the best worded, but the point is I mentioned my points and it was succinct and I'm done. You're in and you're out. You see what I mean? So that's how I would prepare for every question. All right. So, but you see, Dr. Jorge, this stuff, if you mention these 3 points, they're going to remember that. They're going to be like, oh, wow, you were an MA. I mean, that really sticks in your mind. Now, if you say, oh, well, you treat people of every age, you know, I can build relationships and education. I mean, no offense, but they know that already. They already chose family medicine. It's too late. Yeah, it's too late, Dr. Jorge. They already chose family medicine. We're not changing their minds. So we don't need to tell them why family medicine is awesome. That's not the point. The point is you need to talk about yourself. Okay. So you talk about how you're a general surgeon and then you're an MA and then you're an assistant physician. Oh my God, like this is all so unique. And this is because you're talking about yourself and you're very unique. You will distinguish yourself from other people, especially if you say you're an assistant physician. They're going to say, whoa, 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 whoa. Tell me about this assistant physician thing. What do you do again? You see what I mean? Yes. So what I want to say is when you think of your 3 points, make it all about you. I'm not talking just you, Dr. Jorge. I'm talking to everybody. Make it about you. What about you that you, and even forget about the question for a second. For a second, just forget about the question. Just think, what about you do you want them to know? Because that is your opportunity for them to know you. Okay, so don't spend time talking about why family medicine is awesome. Talk about you to support why you should be in family medicine. Okay, and then cap it off. Again, I apologize. This is all in caps. Shouldn't be, but anyway, you just say, this is why I would be a great fit for your program. All right, sound good? What questions do you guys have? I'm sorry, was I yelling? No. Okay. It's just want to make sure we make the point, you know what I mean? And it's actually very interesting when I remember when I was interviewing, I remember in the beginning, like I was doing this, and then actually like halfway through the season, you started to get good at this actually. So you know what I remember ending up doing was they would ask me a question. I would take a few points from one question, a few points from another question, you know, I would actually mix the points. It was actually kind of interesting. I felt like after the interview season, I could be a politician because you're so like you're prepped with your talking points. These are your talking points. So it was actually interesting. The question doesn't even have to match exactly. Like for Dr. Jorge's example, it's like, no, not why the specialty. Why are you changing specialties? What I want to say is, it doesn't matter. It doesn't matter. You have your talking points, share your talking points about specialty. So even if the question is not exactly close enough, use your points if it's close enough. So, just deliver the talking points that you prepped for, basically. Good. Do you guys want to practice one more, or do you want to move on?
One more, please.
One more, okay. All right, guys. What question do we want to practice? Give me a good question. Wasn't somebody saying that there was a question that they had
Yes.
trouble with last year?
Oh, yeah. How do you resolve conflict? That was the question.
Oh, how do you resolve conflict? Okay. Good. All right. Okay, what points do you want to mention? Like, just think of some points. Who is this, by the way?
I was just reminding of the question.
That was me.
That was a question from Itur. Yeah,
For who?
that was Itur's question.
Oh, okay. All right. So what talking points do we want to say? How do you resolve conflict? Okay, good question. What do we want to say?
Conversation.
Okay, talk about it. Good. Anything else? Mm-hmm.
I guess be a good listener and stay calm.
Good listener. Good. Anything else? Good listener and stay calm. Okay.
Maybe a cool off period.
Cool off period. Very good. Okay. All right, guys. Now, if I'm prepping for this, I am thinking, what do I want them to know about me? So what do I want them to know about me? I'm an AP. I'm not joking. I am not joking. I would hit the AP thing hard, okay? So how do you resolve conflict? I want them to know I'm an AP. Okay, that's number one, all right? Number two, what else do I want them, do I want them to know about me? Let's see, Marie, what do you want your interviewers to know about you? Forget about the question for just a moment. What do you want them to know about you?
I don't know.
Come on.
Let's see. I'm an educator, maybe.
An
No.
educator. Can you remind me, Dr. Marie, educator in what capacity?
Well, all right. Well, right now, I'm an IEP team associate, but I used to be a special education teacher.
Very good. Special education teacher. Good. What else do you want them to know about you?
For this question, resolving conflict.
Just in general, what do you want your interviewer to know about you?
Okay.
What is on your resume? What is on your resume that you really want to show off? Remember, we're talking about you now. It's all about you. What do you want to show off about yourself?
I have clinical experience working with patients with mental health disorders.
Mental health is in what capacity?
I was a case manager.
Beautiful, beautiful. Case manager, mental health. Oh yeah, that's beautiful. And then AP, yeah, so I think we've got some stuff to work with here. So when I think case manager and mental health, what you're doing is you're helping patients navigating the system. And by definition, you're navigating conflict. I mean, you can make a case, right? Special ed, if you're a special ed teacher, you're used to dealing with people with like a wide range of capacity to understand. Some people understand things very well. Some people don't understand things. So then you have to be accommodating. Okay. So for me, I'm thinking special ed, accommodating. Case manager, navigating conflict. Good. And then AP. My goodness. I like basically how would being an AP help as far as resolving conflict? What conflicts have you had, Dr. Marie? Any conflicts that you've had?
Not
Dr.
really.
Cecil give you a hard time with anything?
I mean,
actually, it's not a bad idea. Hold on a second.
I can think of. I'm going to interject here, if that's okay. Help out Maria a bit. I was just thinking of a patient that Sybil had on Saturday, whose results came back in. This is the patient who didn't want to take any statins and didn't want to do anything like that. I think that could find a way to fit in here.
Yeah, patient with a statin. Beautiful, beautiful.
Right.
Excellent. Okay. See, if you're prepping the night before, you can think about this stuff. All right. Okay, fine. I was going to say conflict with Dr. Cecil about scheduling, but you know what? That's fine. That's fine. We can do patient and statin. Good save, Dr. Cecil. Okay. So, all right, very good. All right, so let's think about this. All right, case manager, that has to do with like navigating conflict. So that's a skill by itself. Special ed teacher, you learned that you have to be accommodating of wide ranges of understanding, okay? And then you practiced these skills and what you learned when working with a patient and advising him on whether to take his statin, okay? So those are the 3 points. You have highlighted that you were a case manager, which by the way is awesome. I mean, a mental health case manager, I mean, that's a great background. Are we applying for family medicine?
Yes, I am too.
Oh yeah, okay. You have what now?
Yes, I am.
You are, okay. So I mean, that's a wonderful background. Special ed teacher, AP, I mean, wow. I mean, this is wonderful. Okay, so Dr. Marie, let's give it a try. Why don't you ask me, Dr. Murad, I'm gonna give it a try here with these points. I'll do my best. Say, Dr. Murad, tell me, how do you resolve conflict? Ask me the question.
Dr. Murad, please tell me, how do you resolve conflicts?
Well, thank you so much for the question, Dr. Marie. I can tell you that in my previous job as a case manager, an important skill that I developed was navigating the systems for my patients who often had mental health problems. And so by definition, I was navigating through conflict on behalf of my patients. I can tell you that as a special education teacher, I learned that there is a wide range of understanding of my clients and that I needed to be accommodating of that wide range and to meet my patients where they're at. And more recently, as an assistant physician, volunteering to take care of primary care patients under the supervision of a family physician, I had one particular instance of a patient who needed to be on a statin, and all those previous experiences of navigating conflict and accommodating wide ranges of understanding all came into play when counseling my patient on taking his cholesterol medicine. And so I believe that these experiences would make me a great fit for your program.
Good job.
Done. Like, done. Okay?
Awesome.
So we don't need to know. So I don't mean to be offensive, but we don't need to know. Talk about it, good listener. Yeah, we know that. We know that, but that's not what they want. They want to know about you. They need to know about you. What about your background that addresses how you resolve conflict and why you'd be a good fit for the program? So you talk about you're a case manager and a special ed teacher and that you're an assistant physician. That's what you talk about. We don't need to answer the question, people, okay? Don't worry about answering the question. Think about what about you do you want to share with them? And that is how you will answer the question. So you will answer the question, but remember your points are what is it about you, okay? I can't emphasize that enough. All right. So you guys good, or do you want to do one more? It's 9 o'clock. You guys want to move on? We do have some more material here. Alternatively, after this session, we can meet one-on-one if you want. I've done that before. Has anybody at the Medina Clinic, have you seen some of the restaurants close by at the Medina Clinic? There's like a Taco Bell, like a Dairy Queen. There's a Waffle House. I've sat with APs in almost all of those locations. Going over interviewing, actually. So we can always sit one-on-one to discuss this if you would like. But I'll be happy. We could do one more question if somebody wants. So it's up to you.
I think the most common question, tell me about yourself.
Beautiful. Tell me about yourself. That's exactly right. Tell me about yourself. Okay, Dr. Adam, go ahead. Let's give it a shot. What are your 3 points?
AP.
Very good. See, off to a good start. That's exactly right. Good. Okay, good. You guys see, you really just need to think of 2 points if you think about it, because one of your points is always being an AP. All right. By the way, just so you know, in an interview, they're not going to ask you 10 questions. 10 questions would take hours. They're only going to ask you a few questions, actually. So if you prep for 10 questions or so, you'll be more than ready typically. So, okay, second point, Dr. Allen, what do you want to say?
I have a background of I've done clinical rotations and family medicine and
Okay.
in different settings. So I've done preventive medicine, like a HIV clinic in South Miami, Florida.
Oh, where in
And,
South Miami? I'm curious.
it's an hour away from. It's called Community South Health Center. I don't know if you're aware of that area.
Sounds like an FQHC, what it sounds like.
Yeah, it's called CHI, Community Health.
Yeah.
And I've also done family medicine procedure at LSU. So I've noticed that the family medicine has a vast, like I didn't know there was a lot of procedures and all sorts of things when I first started. So it was something interesting, and they also had inpatient. So.
Okay. Give me one more, because the last 2 I feel like are kind of the same thing as far as rotation experience. So AP, rich rotation experience, good. Anything else?
And I've done recent research in family medicine. I've published an article on, I don't know if that counts as one or not.
You know what? Tell me about yourself. I'm glad we talked about this one. This is a pretty broad one.
Yeah.
Whenever someone says, tell me about yourself, this is generally pretty broad. And typically your points cover different phases of your life.
Right.
So I would say AP is one phase. Another phase is like med school. So I think med school, is there? So yeah, this is a good one. So tell me about yourself. We're talking like, big chunks of your life that would be each one is a point almost. Give me something else. What's another phase of life that you would want them to know about yourself? So there's med school, AP, what else?
I guess hobbies or something besides medicine.
Yeah, I wouldn't. So also good. I'm glad we're talking about this. I wouldn't do hobbies here because you know what? That's going to be another question by itself. Usually someone will tell me, what do you like to do for fun? So that's one by itself. But what did you do before med school? So think chronologically. You were an AP. Before you're an AP, you were in med school. Before you were in med school, where were you? Or what were you doing in between? Think in terms of that is what I would suggest.
I was in medical academy in high school, and my interest in family medicine began with my mom. So for this story, I've kind of thought of my mother being the like where it began, because I was constantly monitoring her insulin and periodic visits to hospitals. So I was taking care of her.
Okay, so your mom was a family physician?
No, mother was the influence where family medicine interest began.
Okay, mother with diabetes. Okay, perfect. Where did you grow up?
In New Orleans.
Well, that's right. We were talking about that.
Yeah,
that's
I was born in Pakistan. So I don't know if I need to mention being born in Pakistan and just transit to growing up in New Orleans, or it's not necessary.
Depends. It depends. I think you want your points to be very clear. So you grew up in New Orleans, mom with diabetes. Good. You went to med school. Where'd you go to med school at?
Avalon University School of Medicine.
Good. Avalon. Where at?
In Curacao, in Caribbean.
Okay. How do I spell the island?
CUR.
Uh-huh.
ACO.
Oh, okay. You know what? People don't even know where Curacao is. I would say at Avalon, Avalon abroad, because people usually they may not be as educated as you would like them to be. So,
Okay.
then, okay, good. So you grew up in New Orleans, mom with diabetes, med school, AP, perfect. All right.
Mhm.
So you can think about this a little bit more, but I think this is good for now. So when they say, tell me about yourself, remember, guys, remember, when you're thinking of your points, you're thinking about you. What do you want? Now tell me about yourself. Clearly it's about you, but any question that they ask, think, what do I want them to know about me, regardless of the question almost. And then do your best, but the question that your answer does not have to be the most outstanding, original, most awesome answer ever. It doesn't. It just needs to be solid and succinct, okay? So, Dr. Adam, tell me, why don't you ask me the question? I will do my best with these 3 points.
Okay.
Okay. Why don't you ask me the question? So tell me about yourself.
So, Dr. Mara, tell me about yourself.
Absolutely. So I grew up in New Orleans, Louisiana. My mom was a diabetic patient. And so that was my first exposure to being a caretaker with someone with a chronic medical problem. And it was my first exposure to a family physician. Later, I enrolled in medical school at Avalon University abroad, where I was fortunate to get a rich experience in multiple rotations that included HIV care in South Miami, as well as numerous procedural clinics. Later, after graduation, I became an assistant physician where I functioned as a mid-level independent family medicine practitioner, volunteering in a primary care charitable clinic under the supervision of a family physician, where I prescribed medications, did office notes, did refills, made referrals, ordered imaging, and took care of the whole patient. And this experience really inspired me to become a family physician. And for this reason, I believe I would be a great fit for your program. Something like that.
Wonderful.
Okay, something like that. You've got your points. You just deliver your points. Make it quick. Don't worry if the points are the most awesome answer ever. It doesn't matter. You thought about it. It's solid. Deliver them and cap it off. Okay.
Awesome.
That's all you have to do. If you do that, then what happens is you generate interest. Oh, like remember when we were talking, I was like, oh, New Orleans. Oh, cool. I lived in New Orleans, People remember that. Like New Orleans is like Mardi Gras, And then, oh, Avalon. Oh, that's cool. That's the first time I hear about Avalon. Oh, wow, And then, of course, you talk about being an assistant physician. Well, all right, then. That by itself will generate conversations. So, good. So that's all you have to do. All right, guys. So if anybody has any additional, like if they want to do some practice stuff afterwards, just reach out to like myself or Dr. Cecil, and we'll look to set something up. All right. Are we ready to move on to the next slide? Yeah. All right. So again, here's what the page should look like. Honestly, it's literally like one page. It's like one page. And I've got my stuff on there, and I just study it. It's one page. It's not going to take that long. And then you should be prepared. All right, moving on. So then later, at the end of the interview, they're going to ask you, do you have any questions? What are you going to say when someone asks you that? Are you going to say no? Are you going to say, I don't have any questions?
You should always have a question.
Always have a question. I mean, it's like, really? You're going to spend 3 years of your life here? You have no questions. So no, you always have questions. And what I did, which I think it didn't hurt me at all, is I always had my questions written out. I never really trusted myself, basically. I just in case I had my questions written out. And actually what I did, I remember when someone said, do you have any questions for me? I would ask, well, I have the questions written in my, in my folder. Is it okay if I pull it out? So, do you think that that's okay? Do you guys think that's okay if you like whip out a list of questions? Do you feel like that's all right?
Yeah.
Yeah. I mean, what are they going to say? No? Are they going to say, no, you can't pull out your questions? I mean, what are they going to say? I mean, are they really going to say that? No, they're not going to say that. Nobody's going to say that. So no, it's fine. In fact, they would say, oh, of course, please, and then, it shows a certain degree of preparedness. So I think arguably it's, it's a good thing to do. So anyway, you have your questions. Now, it's a good idea to tailor your questions to the person who's asking them, okay? So different people care about different things. They're all wondering, are you a good fit for the program? All of them. But the questions you ask them are going to be a little bit different, okay? By the way, the questions they ask you are also dependent on who they are. So for example, so just backing up for a second about the questions they ask you. So the program director, they're going to ask you questions like, they're going to be worried about your transcript, like, did you fail any classes? Like, they're going to be worried about like your test taking. That's what your program director is going to be worried about. Like, they're worried about, are you going to burn out of the program? Are you going to fail? Are you going to not be able to pass your board exams? That's what the program director is worried about. Are you going to be like disruptive to the residency program? Are you going to, because someone, if a resident's not performing well, they're going to be worried, are you going to take up a lot of our resources? Okay, so that's what the program director generally is worried about. A faculty person will be like, can I trust you to take care of like patients? I mean, they all care about that, but in particular, the faculty person will be like, I'm going to be on call with you. Can I trust you? Are you going to present well to me? Can I trust you that you're going to execute on the patient plan? Okay, can we work well as far as the team? Okay, basically, can I trust you to take care of patients? Residents are going to be wondering, can I work with you? Can I share call with you? Are you someone I can get along with? Are you someone who can attend social functions with us? Okay, so, that's what the residents will kind of be worried about. Now, on the flip side, when they ask you, do you have questions for me? Yes. For the program director, you want to ask, tell me about the process for which you develop your rotation sites. Tell me about the direction of the program. Is the program in good standing with the ACGME, for example? As far as faculty, what do you like, as far as questions for them, what do you like to see in residents? Okay, what do you see as success factors? What do you think are factors that will lead to success in residency? Will I be able to learn this procedure? Okay. For the residents, how are you evaluated? How do the faculty evaluate you? What is it like being a resident here? Do you feel like you have enough supervision, or do you feel like you have enough support? That kind of thing. So you tailor your questions to the person you are talking to, all right? Oh, by the way, yeah, the residents will most likely, by the way, when they ask you a question, they're going to ask you, what do you like to do for fun? That'll be a resident question. That's usually the residents who ask that. So you can ask the resident, what do you guys like to do as far as social functions go to relieve burnout? Okay. That would be a good question to ask, possibly any one of them. You could ask about burnout, actually, but maybe from the residents, you could ask, does the program take safeguards for burnout? Does the program violate work hour restrictions? Maybe you can ask that of the residents. So anyway, think of your questions for the person. Something else that I used to do is I used to look them up. Like I would go on the internet and I'd look them up. And good chance you can find out a lot about these people. So what happens is they give you an itinerary, and they will tell you who's interviewing you. So what you can do is go online and look them up. You know, you could be like, let's say a faculty member is interviewing you, and you look up that faculty member, and then you see that that faculty member has an interest in, let's say, OB or women's health. So then in your question for the faculty member, you know, because the faculty will ask, do you have any questions for me? You would say, yes, I see, you know, I understand that you have an interest in OB and women's health. And when you ask that, the faculty member will be like, oh, wow, they know about me. Oh, wow, you know, you kind of boost their ego a little bit, you know? So then you do that, and then you ask what, do you feel that if I come to this program, I will be able to get a sufficient number of deliveries? See, you look the person up, you know that this is their area of interest, and you ask a relevant question. So this is how you can actually look the person up, because every program talks about their people, okay? It says, meet our residents, meet our faculty, you know, and you can look them up. So then when you look them up, you can be like, oh, this is a question I can ask them. All right, so that's one way I would prepare for that. So any questions about that? No? No questions? Dr. Cecil, your group is quiet.
I think it's because you're giving us so much to digest and integrate into our prep.
Oh, Dr. Cecil, you're being too
Which is
kind, Dr.
sufficient.
Cecil. No, you're being
Oh,
too nice. But I will say that this is recorded after all. So, you know, this can be available afterwards. Okay, guys, so let's, so this is about when they ask you questions. So now we're going to move on to another concept here. Usually for interviews, you will be invited to like a dinner beforehand. Maybe it'll be out with the residents. Maybe it'll be at somebody's house. During the interview day, there's a lunch usually. So, you know, you'll be having lunch. Just remember, everything is an interview, okay? Everything, all right? When you're eating lunch, when you're at dinner the night before, everything is an interview. You treat everything like an interview. So you don't like at the dinner the night before, you don't badmouth your med school or something, okay? Like you're always in game form, all right? It's actually kind of interesting because usually the residents during the dinner the night before, they'll be like, guys, just relax. It's okay, we're just talking, you know? It's almost kind of scary, to be honest. So yeah, I mean, sure, you can relax, that's fine, but just remember, it's still an interview, okay? So please keep that in mind. Another sort of related thing is a kiss of death. A kiss of death is if you're rude to the administrative staff. Like, just imagine you come to the Medina Clinic and you're rude to Maribel, okay? If you're rude to Maribel, unacceptable. Like, it's just totally unacceptable. Actually, Dr. Cecil, weren't we interviewing a receptionist? She did not say hi to you.
Nope.
Oh, she was gone.
She just walked in, like just sat there, did her own thing, didn't say hi to anyone in the room. It was just like, well, you're gonna be doing this for our patients. And
what a joke. Like, that's a joke. Dude, where do people learn how to interview? Yeah, that was a joke. So literally at the Medina Clinic, we were interviewing for a receptionist. And this was before April. This was right before we hired April, actually. And so she comes through and she doesn't say hi to anybody. And Dr. Cecil was right there. She didn't say hi to Dr. Cecil. Like, what the heck is this? What a joke. So we're like, we're not hiring this. We're not hiring her.
No.
So it's the same thing when you're interviewing for residency. All the administrative staff, like if they email you or you're corresponding with them, dude, you're on your best, you have your best manners. Because if the administrative staff says, I don't like this person, then that travels quickly. So don't you be super nice to the administrative people. It's very important. It shows good character. So any questions on that? No? Okay. trying to think of some stories if I can. Can't think of any off the top of my head. I think those are just the general points.
Dr. Murat,
Yeah.
I saw something different this season. They are inviting residents or applicants for open houses.
Yeah.
In my case, I received an invitation for an open house. It was through ERAS that I received, so it wasn't open to everybody. But I don't know how does that work. I never heard of that before. So
Yeah, this is the first time I hear of it, to be honest. Does anybody have experience with this?
Yeah, open houses is just you meeting the residents, and maybe some faculty members might show up. So you just kind of like, it's very casual. So you just hang out and chat and ask questions then. So a lot of the questions about what you do for the hobby and what is the city like, places to live, places to hang out, just them getting to know you on a more personal basis. So it's more casual.
Yeah.
When does that take place? Is that before the interview or?
From last year, it was before interviews. Maybe if you're getting like just a special email, it could be like their form of pre-interview lunches and dinners, since everything is virtual now. So.
Okay.
Okay, wonderful, thank you. I think it's not a bad idea to sort of prep still for these things. I mean, it's not as formal, obviously, but just to kind of have the stuff in your mind, like tell me about yourself, you know, oh, what brought you to this specialty? I don't know. I just feel like if it were me, like even that's an interview and I would prep for it personally, but some may feel that's a little much, and I understand that, but you know, I think to have some points ready to talk about if somebody asks, especially like a faculty. So this is a new concept for me, though. I didn't know that that there were these open houses. So. Okay. All right, so I guess the point that we want to drive home is everything is an interview, okay? You're always being evaluated. So that's what I would share. As far as other things, I would say make sure you sleep well the night before. You know, I know personally, I have a tendency to be annoying if I don't sleep well the night before. So I'm just not on it, like as far as interpersonal interaction. So, so yeah, sleep well. So make sure you're well rested. This prepping should not take hours and hours, like from start to end, maybe like an hour and a half or something. So it should not be that extensive. So make sure you sleep well the night before. The other thing that sort of comes up is off the wall questions. Has anybody gotten a question like this? Like, if you were a bird, what kind of bird would you be? Or some off the wall question. Has anybody gotten these? That's good. Yeah, I don't think they're as common as they used to be, but anybody got like these weird questions that like have nothing to do with anything?
I got a question. I don't know if it's off the wall, but it was the program director. He wanted to know if another resident was constantly asking me to cover for her or him. What would I do? So you know, I don't know if I was supposed to tell on the resident. I don't know. So I don't think he liked my answer. In the end, he told me I was supposed to tell him, I think. I'm not sure. But
well, so
you know.
It's kind of hard. Yeah, some of these questions, you know. So I think when you know, so yeah, that's like an ethical decision making kind of thing, you know. So yeah, I think it can be a challenge to think like these off the wall, you know, these questions that come out of left field that you're not really expecting. my suggestion is that if you get a question that really comes out of nowhere, and you really didn't prep for that kind of a question, remember what you're there for. You're there to give some solid, succinct answer, but you're trying to tell them why you'd be a great fit for their program, okay? So whatever you say, remember, I know we get caught up in trying to answer the question. You're not trying to answer the question. You're trying to talk about yourself and why you'd be a great fit for the program, all right? So let's help Dr. Marie out. If that's the case, and it's like on the fly, you're trying to think of something, what, basically you're trying to tie it into why you'd be a great fit for the program. So what would you say? What would you guys say? I mean, if it were me and someone gave me an off the wall question like that, I'm like, well, let's think. Okay. I need to talk about why, like I'm there to talk about why I'd be a great fit for the program. And we're talking about, in this case, sounds like a family medicine program. So I would say, well, I mean, if you happen to know, that's great. But if it's something you really didn't prep for, you can say something like really quick, really brief, like, well, I think that this would be an unusual situation for me, but I believe in collaboration. I believe in teamwork, and whatever it is that I do, it would be consistent within those things. And that's why I'd be a great fit for your program. I believe in collaboration. I believe in teamwork. And actually, you know what I mean? You could just say, I believe in teamwork. I'd be a great fit, but you would word it, you know what I mean? So, other off the wall questions like that one example, like if you were a bird, what would you be? I'd be like, I don't know. I would be like, remember, why would I be a great fit for this program? I know that, it's family medicine. So it's like, well, I would be an eagle because if I were an eagle, I can achieve the highest height and I can get the biggest picture. And that's what we do as family physicians. We get the big picture. And for that reason, I believe I would be a great fit for your program. Something like that. Okay, so tie it into why you'd be a great fit. You do not have to get the right answer. Now, in this case, it sounds like maybe they were kind of looking for something. Is that right, Dr. Marie?
Yeah, I feel like it because it's like he gave me the answer afterwards that he wanted. I said, okay. Yeah. But if I would have answered it your way, I think it would have been better because, and you answered it, but you didn't really answer it.
I know.
Yeah. So that would have worked.
It would, yeah.
Yeah.
I mean, it's true. It's possible they may press and give you a hard time and stuff, and you do your best. But remember, everything is geared towards why you'd be a good fit for their program. To be honest, I think most of the time during these interviews, they're aware that you may not have the answer. Maybe it's a situation that you've never faced before. I mean, I think usually they're aware of that. I think what they want to know is I would suggest they want to know your your thought process. They want to know what your thought process is. So I think if you just turn everything towards why I would be good in family medicine, why I would be a good fit for your program. If you just turn everything to that, I think that's a good direction to go, basically. So, yeah. So anyway, yeah, another off the wall question that sometimes people ask is, if you see a billboard that says this slogan, what does it make you think of? So tie it to family medicine, whatever it is. So like the Nike thing, just do it, right? So so this is another off the wall example. If you saw a billboard and you saw a Nike sign that said, just do it, what comes to your mind? I would say, well, what comes to my mind is that I know in family medicine, we need to intervene. We need to intervene for the benefit of the patient. So just do it tells me that I always need to be vigilant and ready to intervene on behalf of my patients. And I think this kind of vigilance would make me a great fit for your program. Okay? So you tie it to why I would be a great fit for your program, okay? All right. So that's what I would say about off the wall questions. Any off the wall questions about that? No? Okay. All right. Okay, guys. Now this last one, I admit, I don't think, like, I haven't done this in quite some time. What would you guys suggest as far as etiquettes with thank you cards and emails? What's the latest on that?
From what I heard, that you should email as soon as possible after the interview and send a thank you card. And also when you're writing them, kind of brainstorm what you had talked to the person. Remember that, so they can remember you. So it's not just plain thank you, it's more like one-on-one, like what you guys talked about, so they will remember you. More personal.
Excellent. Perfect. Okay, anybody else? What are some of the most recent best practices on this etiquette? You guys agree with what
I
Dr.
think-
Adam said? Or?
Yeah, and I've also heard of some programs that would ask that you don't send anything in the mail, and that you either email or whatnot, but then don't send anything in the mail. So I guess listening to whatever the instruction is for that particular program will go a long way. You don't want to be the only applicant sending in mailed thank you notes when they've specifically said no one should. So you don't want to stand out in a bad light.
Makes sense. Very good. Excellent points. Anybody else? So I think thus far we have, send an email as soon as possible. In the content of the email and as well as the thank you card that's sent afterwards, include content that is specific to the conversations that you had with the person, so that they are able to recall the conversation. And to take note if the program has specific instructions not to send mail, to make sure to respect those instructions. So does that sound about right?
Yep.
Okay, wonderful. Okay, good. All right, guys, I think if we take a look at our objectives, let's see if we covered everything. So we talked about what is the #1 question they're trying to answer. Why are you a good fit for the program? We talked about what a successful interview looks like. Your interviewer is doing most of the talking and you have excellent nonverbal communication. What does your preparation look like? I think we talked about the method of the 3 bullet points. In the 3 bullet points, you might answer the question. I mean, you'll answer the question, but primarily your 3 bullet points are, it's all about you. You're talking about yourself. What is it about you that you want your interviewer to know? And you use that to answer whatever question it is that you're prepping for. And by all means, mention that you're an assistant physician and talk about what you do. That is one of the most critical experiences that you can share. Okay, nobody cares if I volunteered at a hospital when I was a kid, when I was a 16-year-old kid. Nobody cares. But if I'm an AP, they will care a whole lot. So make sure you incorporate that in your bullet points. Always have questions. Tailor your questions to the interviewer. Remember that everything is an interview, whether it's lunch or a pre-interview dinner or even an open house. Make sure you sleep well the night before. With the off-the-wall questions, gear your answers towards why you would be a great fit for the program and you would be a great family physician. That is how to gear the off-the-wall questions that you may not have prepped for. And then to observe the etiquettes regarding thank you cards and emails. So that's what we covered. Anybody have any last questions before signing off?
I do not. I know about the others.
No.
Okay, wonderful. Well,
Thank you so much, Dr. Murad.
yeah,
Yeah.
my pleasure.
Yeah.
Yeah. Well, definitely good luck. Good luck, everybody. And if you want to touch base one-on-one afterwards, just reach out to Dr. Cecil. Just reach out to Dr. Cecil or myself. So best of luck, everybody.
Thank you so much, Dr.
Thank
Murad.
you. Thank you so much. Thank you
Oh,
so
yeah.
much, Dr. Murad. Thank
My
you.
pleasure. All right, you bet. All right, so now we have to find the button to sign off. So it'll take me 5 minutes to do that. So you guys don't need to wait for me. So best of luck to everybody.
Thank you so much.
Thank you guys. Take care.
Thank you. Bye.
Bye.
Bye-bye.
Thank you so much, Dr. Murad. That was very helpful. I'm learning some things. I'm like, I was here last year. I don't remember this. I probably wasn't paying as much attention last year.
Oh yeah, yeah. I know last year. Yeah, I vaguely recall last year, but it was a while ago. So
Yeah.
sometimes when you do the same thing over and over, it gets better each time. But thanks for everything that you do, Dr. Cecil. Really appreciate it.
Thank you. Thank you.
you.
Appreciate it as
You
well.
bet. Absolutely. Talk to you
All right.
soon.